Hi, I'm Dr. Abhishek Mangeshikar, an endometriosis specialist and excision surgeon. Today we're going to discuss a very important and sometimes emotional topic, egg freezing and fertility preservation in endometriosis. Endometriosis is one of the leading causes of infertility worldwide, and many patients naturally feel concerned about their future ability to conceive. But as with everything in endometriosis, there is no one-size-fits-all approach. In this video, I'll explain how endometriosis affects fertility, when and why we might consider egg freezing, and when it may not necessarily be the best option for you. The role of disease treatment in preventing fertility, the limitations of egg freezing in certain cases, and how we carefully tailor fertility planning for each individual. The role of disease treatment in preserving fertility. Let's begin. How does endometriosis affect fertility? First, it's important to understand that not every woman with endometriosis will experience infertility. Many women conceive naturally. However, certain disease factors do increase risk. Ovarian endometriomas or chocolate cysts can damage ovarian tissue and reduce ovarian reserve, meaning fewer healthy eggs. They can also interfere with follicle development and ovulation. Importantly, the cyst itself, which is the fluid inside the cyst, is toxic to egg quality. Number 2, pelvic adhesions. Scar tissue can distort pelvic anatomy, affecting fallopian tubes and ovaries. Number 3, inflammation. Chronic pelvic inflammation can impair egg quality, sperm function, and embryo implantation. Number 4, surgery. Poorly performed ovarian surgery can also reduce ovarian reserve. This is why excision should be done by a specialist using fertility sparing and enhancing techniques. Egg freezing or oocyte cryopreservation involves stimulating the ovaries to produce multiple eggs, retrieving them and freezing them for future use. But here's an important point. If the endometriomas are large or the disease is active, stimulating the ovary can potentially cause more harm than good. In such cases, it may be safer to first treat the disease to protect ovarian tissue and egg quality before considering fertility preservation. In some cases, sclerotherapy may be considered for large endometriomas as a fertility-sparing option before stimulation. Since we deal with more complex cases of deep endometriosis and bowel endometriosis, it is not always necessary for our patients to undergo egg freezing. In these cases, we typically avoid disturbing the ovaries during surgery. Many of our patients go on to conceive naturally after surgery once the deep disease and pelvic inflammation have been treated. This is why individualized planning is so important. We do not recommend egg freezing routinely for every patient. We generally consider egg freezing selectively and only when appropriate. Young women with good ovarian reserve and minimal disease activity. Before a planned surgery, if the patient has small endometriomas and good ovarian function, women who are not ready to conceive now but have deep disease or at risk for future reserve loss, where the ovaries can be stimulated safely. In patients where timing is critical and after thorough discussion of risks versus benefits. When is it not appropriate? If large endometriomas are present, if the disease is too advanced or active, stimulation may damage already compromised ovaries. If there is extensive pelvic inflammation, this should be treated first. If ovarian reserve is already very low, outcomes may be poor, and disease management may be a better first step. In many cases, especially with significant ovarian disease, our priority is to excise the disease carefully, preserving healthy ovarian tissue. Reduce the toxic environment caused by the endometriomas, restore pelvic anatomy, and only then consider fertility preservation options if needed. If egg freezing is appropriate after evaluation, the process typically involves Step 1, ovarian reserve assessment, which is the AMH test and the antral follicle test. Step 2, ovarian stimulation, which are injectable medications over 10 to 14 days, only if deemed safe. Step 3, egg retrieval, which is an outpatient procedure where transvaginal ultrasound is used to guide the aspiration of the eggs. Step 4, freezing. Mature eggs are vitrified and stored. Step 5, future use. Eggs can be thawed and fertilized via IVF when ready. Here are some pros of egg freezing when done appropriately. Preserve future options for selected patients. It may reduce stress in patients needing delayed conception. Advances in technology have improved success rates but still depend on age and disease status. Our limitations to understand is not a guarantee. Egg quality in endometriosis may still be impacted. Large endometriomas must be addressed first, not ideal to stimulate ovaries with very active disease. It does not treat the disease. Egg freezing is a tool, not a solution for endometriosis, and can be costly and is not often covered by insurance. In my practice, we approach fertility preservation very carefully. We do not recommend egg retrieval in the presence of large active endometriomas. In complex deep endometriosis and bowel cases, we usually avoid disturbing the ovaries, and many patients conceive naturally after surgery. In certain cases, sclerotherapy may be a better fertility-sparing option before stimulation. We individualize every plan in collaboration with fertility specialists. The goal is always to protect ovarian reserve, not to rush into stimulation when the ovary is compromised. Egg freezing can be a valuable tool in the right patients at the right time, but in complex endometriosis cases, particularly those involving deep disease and bowel involvement, egg freezing is not always necessary, and many patients will do better with a careful surgical approach that spares the ovaries. Every patient's plan should be built on your anatomy, your disease stage, your ovarian reserve, your fertility goals. Individualized care is key. Thank you for watching. I hope this video has helped you understand egg freezing and fertility preservation in endometriosis and how we approach these decisions carefully in complex cases. If you have questions about your situation or if you'd like to share your experience with fertility planning and endometriosis, feel free to comment. Your story can help others. And if this video was helpful, please like, share, and subscribe for more expert content on endometriosis, excision surgery, fertility, and pelvic health. Take care, and I'll see you in the next video.